Hello, and welcome back to another edition of our NEMA Partners University. I'm very excited for today's session with Dr. Holtorf. Dr. Holtorf is the medical director at Holtorf Medical Group, and he's been treating patients struggling with different symptoms, unexplainable conditions, and using a lot of traditional medicine. He is also a great proponent that is using peptide therapy, and he's here to share his knowledge on peptide therapy and how that can help our immune systems and our gut, and those of us struggling with celiac disease and gluten intolerance and other gut issues. Dr. Holtorf, so happy to have you here today. And
Oh, thank you for having me. It's an
yeah,
honor.
very excited about today's talk. Peptides are kind of I feel like, new frontier of medicine, and some people are starting to hear more and more about them, and they can just do such amazing things. So really excited to dive deep and see how this can help our gluten-free community as well. So let's go ahead and start with, what are peptides and how do they work and how do they support our
Yeah,
bodies?
and just
Do an
with
overview for us.
peptides, and I had, with my history, like yourself, ended up with Lyme, Babesia, Bartonella. I went into heart failure, and my heart was all fibrosed because I had high human transforming growth factor beta, which caused fibrosis, and I couldn't go upstairs. I couldn't walk upright. And I go to the cardiologist and he's like, your heart is fibrosed. He goes, you will maybe get 10% better in 10 years with, rigorous cardiovascular rehab. I'm like, no, I'm not living like this. So I said, either I'm going to off myself or I'm going to go find a treatment that works, and just went around the country, around the world. And I was in Belgium and I took a number of peptides, didn't think anything of it. And then, like, about 4 to 5 days later, I'm like, I just walked up the stairs upright. Wait a minute. What did I do?
Mhm.
And so kind of backtracked and started using them more, and then brought them out here. Couldn't at that time use them on patients, but then that became okay. And it's really, I mean, it transformed my life and it's transformed our patient's life. Any doctor that uses these, it just makes medicine so much easier.
Mhm.
And you can get from A to B, so much faster, especially with these multi-system illnesses and the gut. I mean, they just work fabulous, and really for everything. And really, we've become like, with Lyme, we were kind of on the Horowitz camp, like just massive antibiotics. And I did, 3.5 years of the highest dose antibiotics you could ever imagine, like 7 at a time, 4 times the max dose. Nothing. Well,
Mhm.
problem was my natural killer cell function was zero.
Mhm.
So that a part of the immune system that kills intercellular infections was zero. So it doesn't matter how many antibiotics you take. So we started, looking at the immune modulation, and it's just really transformed our practice. And it fits for almost every illness because as you get older, so just with aging,
Mhm.
your thymus here and your breastbone. And after like age 9, it starts going down. And then by 30, maybe 40, it hits its nadir, it's the lowest point.
Mhm.
And what that does is, now, if you think of the immune system, two sides of the immune system, one's Th1, one's Th2. Oversimplification, but you have to with the immune system. So Th1 gets stuff inside the cell, Th2 gets stuff outside the cell. Now, as you get older, your Th1 drops because the thymus involutes, and Th2 goes up. So now you can't fight new infections, intercellular infections, and you have all this inflammation, prone to autoimmunity. And so, and also, if you get chronic infection, inflammation, autoimmunity, that it keeps driving it more like this. So it's a very aged, sick phenotype immune system. So the first thing we do with people is look at this ratio, this Th1 to Th2 and Th17, and we can tell, like, hey, something's going on here. And depending on how bad it is, and other markers, now we know to look for chronic infections and toxins and
Mhm.
all these other things.
Mhm.
So, and everyone has a terrible immune system now. It's just, and stress. People think stress lowers your immune system. No, it modulates it. It lowers the part that you need, but it raises inflammation.
Mhm.
So, really looking at the immune system is key. And really, the immune system is the number one contributing cause to celiac.
Wow. Very interesting. Yeah, you
and just
sometimes wonder because
sensitivity.
it's like I know a lot of times it's a trigger, right? That's whether it's stress or an infection or something kind of triggers it on. So
Yeah.
it's interesting that it always comes down
And
to the immune
and then that's like
system.
with the Lyme patients, like they'll have, also they'll have a lupus antibody, an antiphospholipid antibody, Hashimoto's, and they go and they get all these diagnoses, and then they go to the rheumatologist. Oh, well, it's genetic, and this is for life. No, it's going to go away,
Mm-hmm.
and because the immune system's just so, it's so revved up over here, but it's not doing what it's supposed to do over
Yeah.
here.
So how can peptides help kind of modulate that and balance that out?
Yeah.
Is that the best solution for helping to modulate the immune system, or are there
Yeah, I mean, there's most of the treatments that are effective are actually immune modulators, ozone, vitamin D. I mean, there's just, IVIG. There's so many things, glutathione. I mean, they all modulate the immune system, but the, the most potent ones and really the safest are peptides.
Mhm.
And so let's kind of go back to what the heck is a peptide? And we used to think that hormones kind of ruled the body and told the body what to do, but they kind of do in a more, gross overall sense. And peptides are a layer above that fine tune everything.
Mm.
And they're compared to hormones, they're much more specific. They're much faster acting. Also, they are shorter in duration, but they also do change epigenetics. So they change gene expression and all that. And when we talk to bioregulators, I'll talk a little bit about aging, and
Mhm.
maybe we'll go to senolytics, but it might be a little too much out there. But um, and hormones go into the cell, go into the DNA, change protein synthesis, and then that will make new proteins, tells the body to do X, Y, Z. Where peptides work on the cell surface and have signaling molecules. So they're faster. They're kind of the fine tuning part of the body.
Okay. All right. Awesome. And
And
then
yeah, and so yeah.
do our bodies already make peptides or have peptides in them, or do we have to use them from an external source?
Yeah, so your body naturally has all these peptides.
Mm.
I mean, the ones like, let's say, semaglutide is a peptide. I mean, they tweak it so they can have a patent on it. The ones that we use are all bioidentical.
Mm.
So they're not taken from an animal or a human. You don't want to do that. They are made, synthetically, but they're bioidentical, meaning your body can't tell the difference.
Got it. Okay, great. And then so let's talk about some peptides that could be useful for people with either celiac disease or gluten intolerance or any sort of gut issues. What are some ways that they can support their body using peptides to see if it can help?
Yeah, I'd say the first thing you want to do is look at your immune system. And I don't think I've seen a celiac, patient that doesn't have that, call you Th1 to Th2 shift. And so it shows that something's driving that, whether it's a chronic infection, toxins, stress, which causes immune modulation. And some interesting studies showed that they had, like, heavy metals. They say, well, it can cause autoimmunity, but by itself, like if you have any one of these things or two of these things, you're probably okay. But as soon as you get three, like that seems to really set everything off. And then in one study, it was in Africa, not coal miners, metal, were they mining cobalt or something, where they got exposed to heavy metals, and they didn't get autoimmunity unless they got malaria.
Hmm.
And the ones that got malaria that weren't have the huge heavy metal exposure didn't get autoimmunity. So
Um,
it shows how everything kind of basically goes together.
yeah, it's like the
And
perfect storm has to come together to take
yeah,
into account multiple
and
pieces.
and that's why we're seeing so many people with autoimmune disease and sensitivities
Mm.
and gut issues. I mean, what we're putting in our bodies is just ridiculous.
Mhm.
And I was reading a study a couple of weeks ago where basically metal nanoparticles that they're putting in the food seems to be combining with the gluten, making them much more reactive. It's like,
Mm.
what else are you gonna, put in the food for us? And all
Mm-hmm.
the additives, they just, cause a lot of inflammation. And with celiac, there's always leaky gut, with the inflammation.
Yep.
And so typically the first thing you want to do is modulate that immune system. And the immune modulators, and there were a study came out. So the thymus is essentially the body's immune modulator.
Mm-hmm.
And they gave growth hormone, metformin, and DHEA, and they go, "Oh, we rejuvenated the thymus, right?"
Mm-hmm.
And the study was a little, maybe not the best study in the world, very small too, but it got all this press. But like, why go to that length when you can just give thymic peptides, and which are safe and much less expensive? And so and people get kind of confused. There's like all these different thymic peptides. The body has like 20, 30, depends on, how you count them. There's fragments that work as well.
Mm-hmm.
So probably the thymic peptide that has the most studies on it, has been around the longest, is thymosin alpha 1, approved in about 35 countries for infections, autoimmunity, cancer. But they made the mistake of having a study on COVID early on, and it shows it was safe and effective against COVID.
Mm-hmm.
So they banned it because they couldn't, if that worked, now they can't have the emergency, basically vaccine.
Mm-hmm.
So thymosin alpha 1 boosts Th1. Thymosin beta 4 is more of it will increase Th1, lower Th2, has some other rejuvenating properties. The one problem with thymosin beta 4, the middle fragment, it's a multi-domain peptide, meaning that it has different parts.
Mm-hmm.
And the middle domain will actually stimulate mast cells,
Mm-hmm.
which can be good in a healthy person to heal, but it's generally not good for celiac, gut, any chronic, but basically chronically ill, chronically infected patients.
Mm-hmm.
Then you have basically like a thymogen. So thymogen is only 2 amino acids, so it can get everywhere. It's orally active,
Mm-hmm.
and it's about 100 times as potent as thymulin, which a lot of people use. And then another was called bioregulator. And so bioregulators are a new thing. They're only 2 amino acids long, 2 to 3, sometimes 4. But they didn't think they did anything, because how could just something, a couple amino acids, actually have such powerful signaling?
Mm-hmm.
And so when thymosin alpha 1 got banned, we went to basically a lab that did metabolomics, transcriptomics, and a number of different things, where we said, okay, let's see which thymic peptides will outperform thymosin alpha 1.
Mm-hmm.
And so we came up with a thymogen and the Vilon combo, which is called thymogen alpha 1 instead of thymosin alpha 1. And we're getting great results with that. And because it's also very potent at lowering human transforming growth factor beta, which I think is really the key inflammatory marker, to get down, because it causes fibrosis and so many issues. If anyone's interested, I have just finished a Sears ebook. It's called the Peptide Protocol for the Rapid Treatment of Sears Chronic Inflammatory Response Syndrome, which is typically mold and Lyme together. There are all these different syndromes. They're all kind of lumped together. Like when we say Lyme disease, person usually doesn't just have Lyme disease. They have multiple things, and everything becomes a vicious cycle. So when you have the immune dysfunction, what happens? Okay, the body will basically, it will suppress the pineal hypothalamic pituitary hormone axis. So now you have low hormones, but they look normal, or like your thyroid's low, but your TSH looks normal or low. You get basically immune activation of coagulation. So you get like the body lays down fibrin, and now nutrients can't get in the cells, and oxygen takes normally 2 seconds to get in the cells can take up to 2 minutes. So people get air hunger, poor endurance, and they get mitochondrial dysfunction. And that's when everything really starts going awry because mitochondria are needed for, basically, energy for every cell. And they'll go into what's called cell danger response. And instead of making energy, they start making inflammatory cytokines and they go into what's called senescence. And so with anti-aging, and we'll do this with especially someone with long-term, with cancer, any long-term term stimulus or autoimmunity or chronic sensitivities, is that it drives the cells into the cell danger spot. They kind of give up. But not only are they not doing anything, now they're making inflammation instead of energy.
Yeah.
So we can now selectively knock out those senescent cells that the body should have taken care of and basically gotten rid of and basically recycled those, but they're sticking around and causing all these problems. So it's really big in the anti-aging, and we're finding with chronic illness that sometimes it's like, gosh, nothing's working. You get rid of those cells, and all of a sudden, like diabetes reverses, congestive heart failure, all those things.
Wow, that's so interesting. That's amazing. So let's talk a little bit about what peptides can really support the gut. So we went over the different types of thymus and how that can help with immune modulation. Tell us a little bit about KPV and BPC 157. How do those
Yeah. So in terms of the thymic peptides for the gut, the TB4 frag is unique. So it's thymosin beta 4, but we left out the part that stimulates mast cells and just took the immune modulatory part, but it also directly heals the tight junctions. So it has a special function. And then BPC is kind of known for its gut protection. There's so many studies that it protects against, ulcers, any liver issues, inflammation, leaky gut. And it's probably, it does so many things. And when I first lectured on these, I'm like, everyone's like, how can it do all these things? But here's all the studies. They did, for instance, to rats with inflammatory bowel disease and MS orally, and it worked for both. So it does so many. It works for basically torn tendons, fractures. You kind of name it. It's kind of that overall healing hormone, healing peptide. And then KPV is it's actually the last three amino acids on melanocyte stimulating hormone. And a lot of, I wouldn't say a lot, but some of the Lyme literate doctors were using melanocyte stimulating hormone to lower inflammation. And the problem is it stimulates melanocytes. Now, if you're young and have great skin, you get tan, but if you're older, you get blotchy and you look kind of funky. And when I was taking, I'm very ADD. I'm like, this isn't working. I kept taking more and there's a delay. All of a sudden, I was like, someone painted me black, and everyone's just like, oh my gosh. So it's interesting. But so with that combination of those three has just turned so many people around. And you can use other stuff too, of course, probiotics, and we like IgG, and prebiotics, and basically butane, there's so many things, butyrate. But those three, and for instance, we had a 9-year-old girl come in, and they basically, she had Crohn's, and they were going to take her colon out because she couldn't tolerate any of the chemotherapies, and it wasn't working. And she heard about us, and she wanted to go very slow. All we did was give her BPC, and it was about 30%, maybe a little more better just from that.
Wow.
Then we started adding, the TB4 frag and KPV, and all of a sudden she's just dramatically better from just 3 supplements. And she went through agony, just, bloody stools, and just, couldn't keep weight on. And it was interesting. The mother was at dinner with turned out to be was our ex-president of Integrated Peptides, and she goes, "Oh, and because he asked how her daughter was doing, she said, "Oh my God, it's amazing. We went to this doctor, Hoffentorfer or something like that, and he's like, what? And he turned her life around, saved her life. And have you heard of him?" He's like, "Is it Holtorf?" And she goes, "Yeah, have you heard of him?" He goes, "Yeah, I work for him." So it was kind of cute.
That's
But
awesome.
you see a lot of cases like that, and she would have had to have her colon taken out.
Yeah, that's terrible. That's amazing that just something so simple and taking just three things makes such a huge, huge difference. I mean, I've used peptides a lot in my own healing journey and like always surprised, especially the thymus, different types of thymus, like how much those help me and just like help me feel better, give me more energy and bring my antibodies down on my
Yeah,
Hashimoto's.
and thymus has been around forever, and
Yeah.
and so in our TB we have TB4 Frag Max, which adds thymus. Now it's not a thymus extract because thymus extract you kind of just take the thymus and grind it up, and it works, but
Mm-hmm.
it's a thymus lysate where so it's low molecular weight peptides, probably about 5 to sometimes 10 times as potent.
Mm-hmm.
And yeah, so we get very good results with that.
Awesome. So let's see, let's talk a little bit more about gluten. So, a lot of this audience listening here either has celiac disease or severe gluten sensitivity. We all use our sensor to try to mitigate eating gluten, but no matter how hard you try, sometimes you still get gluten.
Yep, yep.
Do you see anything on the horizon that can help people become less sensitive to gluten so those accidental glutenings don't take them down so much? Or are there going to be any peptides that help in the future? Not necessarily just with gut health, but kind of
Yeah,
mitigating
and
that
we
reaction.
find with celiac, one is immune modulation, but uh, it's not uncommon to not see a big change, right? You're like, hey, what's going on?
Mm-hmm.
And that's when you really want to look for a chronic infection. And the labs, like they've been historically very terrible at picking up infections, or even like candida. It's normally in the gut,
Mm-hmm.
but when you get inflammation, it actually converts the candida to a pathogenic, organism.
Mm-hmm.
And Pseudomonas will actually break down the gluten into more of a toxic immunogenic product that the body reacts to. So it's like again with the microbiome as everything to do with it,
Mm-hmm.
and our the terrain, and whether or not we have enough digestive enzymes and things to break down the gluten. The problem is when you have leaky gut and a big piece, gluten that's not broken down gets through, and that's going to make huge reaction to
Yeah.
the immune system.
Yeah.
And we'll say with yeah, and then like the bioregulators are really neat. Like there's like pancreas, and it
Mm-hmm.
will help stimulate all the digestive enzymes. Also works for diabetes. There's a gastrointestinal one, uh,
Mm-hmm.
stomach, which will lower inflammation. It's actually effective against H. pylori. You have thymus
Mm-hmm.
bioregulator. You have, let's see, what else? Vascular, which kind of we add to everything because if you get more blood flow to everything, it tends to work better. And
Mm-hmm.
you lower that inflammation in the vessels, which tends to cause not only long-term cardiovascular disease, but clotting and that. So great for post-vaccine COVID patients.
Mm-hmm.
And there's just, yeah, all these different bioregulators. And there's a study that's going to be published. They gave them 2 years of bioregulators and they checked their basically biologic age. And they did it with telomeres, and which is it's accurate, but even more accurate is the methylation.
Mm-hmm.
And they found that on average, they lost in 2 years, 7 years in biologic age, really 9 years because they added 2 years. And some people lost, 14 years plus
Mm-hmm.
just
Wow.
from these
Wow.
bioregulators.
That's a lot. Just
Yeah.
taking a supplement basically a day, right? So
Yeah, yeah, and a lot of studies too on like, combining peptides is
Mm,
very powerful. And that's a nice thing. There's really no contraindication of peptide with anything
mm,
I can think of.
mhm,
But like if you take, they had people over 65 with significant heart disease, and they gave them a pineal peptide,
mhm.
epitalin, and a thymosin. Okay, so now, and the pineal peptides actually kind of will regulate the hormones. They'll normalize like the thyroid levels, even without a pituitary. So it kind of makes no sense because it goes pineal, hypothalamus, pituitary, and then thyroid. If you take one of those out, how can this stimulate it?
Yeah.
But it does. And
Hmm.
it fixes the deiodinases, the T4, T3 conversion.
Mhm,
But very anti-cancer. If you can take any one thing for anti-aging, that would be it.
mhm,
But they added it to a thymosin and gave it to people with significant heart disease, and followed them for 15 years.
mhm,
And the ones that got typical, cardiovascular treatment, they had decline in cardiovascular health, endurance and chest pain. They had increased mortality, morbidity, increased cancer. And the ones that got the treatment, and they only had 6 doses in the
wow.
15 years,
Wow.
that their actually endurance increased, their quality of life increased, their mortality decreased, and their longevity increased.
Wow. That's amazing. Love peptides.
Yeah,
That's
yeah.
awesome. So let's talk a little bit about like how you get peptides. So, they started off mostly as injectables. Now then they went to kind of oral capsules, and now you've got these amazing sprays that makes it so easy to take. What's the future of peptides? Are we going to keep making them easier to take? Are they going to have to go back to injectables or certain ones? So give us
Yeah.
the
Well,
details of how we take
it's
these
interesting. Yeah.
magical
And
supplements.
most peptides don't absorb very well.
Mm,
Now, the smaller the peptide, the more likely they're going to absorb, and the less charged they are.
mhm,
And now BPC 157 is 50 amino acids. So it's like they don't know why it absorbs, but
mhm,
it's shown to be equal potent to injection because it does absorb so well. And
mhm,
it's totally stable in the gut. And we mentioned this thing with, like, they call stable BPC, arginine BPC. And it was Sidrick who had the patent on the acetylated BPC. It ran out. So he came up with something new and called it stable BPC, and showed a study where the arginine BPC was more stable in the gut,
mhm,
even though multiple third-party studies showed the acetylated version was stable for over 24 hours in the gut.
mm,
And the problem with it is, so like with the ones we use, they're called capped. So when the body wants to protect a vital peptide or protein, it caps each side with acetylation and amidation.
mm,
So when it does that, now it's not prone to all the digestive enzymes. Now,
mm,
if it doesn't have that, they get chewed up very quickly.
mhm,
So the stable BPC marketing program said, "Oh, it's more stable in the gastrointestinal, in the stomach acid." And which the others, there's the only studies ever shown that, but it doesn't matter anyway. He's using enteric coated, and then once it gets into the small intestine, that arginine will dissociate because of the pH.
mhm,
Now it's just going to get chewed up. So
mm.
a lot of those people selling the arginine BPC, they're adding snack to it,
Okay.
which is a substance used in the pharmaceutical industry that breaks open tight junctions and disrupts the endothelial lining. So, yeah, it's going to absorb more, but you're like just like causing it to, basically destroying what you're trying to fix.
Mhm,
So it
mhm.
kind of doesn't make any sense. But there's a lot of politics in the whole thing.
Yeah.
But yeah. So yeah. Let's see what's up with what was the question
Oh
again?
yeah. What kind of the future is for delivery? Are
Oh,
they all going to be
yeah.
moving more towards capsules
So
or sprays, or are there going to be some that
yeah,
only
and
work
so
as
we're
injections?
finding the studies are showing when you acetylate and amidate, you get much better absorption,
Mhm,
and they're much more stable. And then you can do it. You're not allowed to do sublingual. Sublingual is not a supplement. It becomes a drug, but you can do a mouth spray.
Okay.
That will help.
Mm-hmm.
And our new sprays will not have alcohol in them, which a lot of people didn't like.
Mm-hmm.
But we've worked for years to get liposomal. And the
Mm-hmm.
problem is with you go get a liposomal product, it's almost always someone they take whatever it is, they shake it up with phosphatidylcholine and call it liposomal.
Mm-hmm.
It's, the liposomes have to be precisely formed and stable. And so this is a big pharma company, so it's expensive,
Mm-hmm.
but they guarantee with electron scanning microscopes the particular size. They guarantee for 2 years they'll be stable.
Wow.
And with that, we can now basically encapsulate longer peptides
Mm.
into the liposomes. And that will absorb very well, and it will be protected as
Awesome.
well. And so that's going to really expand our ability to do a number of peptides.
Mm-hmm.
And when you look at the area under the curve,
Mm-hmm.
that you get so much more in uh,
Mm-hmm.
when you do liposomal. And they actually are shown to go to the target receptors much better.
Mm.
And also the acetylated and amidated version of the peptides also bind to their receptors with a higher affinity.
Mm-hmm.
So the amidated and acetylated are much stronger than the they call them salts of the peptides, like arginine salt, sodium salt. Yeah.
Awesome. That's great. Well, is there anything else you want to add for people to learn and know about peptides? Or I feel like we covered good
Yeah,
information,
and so
but
I know
any
we're
other
very
last
excited
tips?
because it's just so many cool things are coming out with the bioregulators, so we can combine them and they're so it's just kind of unbelievable that these small little amino acids
Yeah,
are doing that.
so
And we're going to
powerful.
start some clinical trials, and we're also excited about that and bringing out a wider range. And the bioregulators are expensive and
Mm-hmm.
very difficult to get because they're coming from Russia.
Mm.
So we'll make them, and we test the heck out of everything, and they'll be very pure. We're really looking forward to that. And if people want to learn more, there's some good training courses out there. We're starting I've been asked for so long, I finally gave in, but we'll be doing a year-long training course, one for physicians, and then also we'll start right after that one for health coaches. And
Awesome.
maybe I can get you to speak for us.
Yeah, I'd love to be part of the class too and learn. I'm fascinated with all this stuff. So it would definitely, I always
Yeah,
want
I
to learn
think
more.
health coaches are great, and it's the way of the future because, we're all, especially doctors. I tell people, okay, here, take this, 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 and the patients are like, well, it's like to them, AXD equals MQW, like can't remember, and they
Yeah,
get home and they
so
understood when you
overwhelmed.
explained it, but they get home and their wife or husband like, well, what is it? I don't know.
Yeah.
And so the health coach can make all the difference in
Mm-hmm.
getting better or not, and it's well worth the cost and
Yeah,
the effort.
I agree. It helped me when I was healing, so that's made me want to do it too to help other people. So,
That's nice that you giving back and what
mhm.
helps you, and people need some sympathy and someone that's been through it,
Mm,
because with all these illnesses, and celiac maybe not as much because it's like an accepted thing, but someone has chronic Lyme or chronic fatigue
mm,
syndrome, even their friends were going, oh, I think she's just lazy,
mhm.
and it's just horrible.
Yeah.
And people are generally sympathetic for about 2 weeks,
Mhm.
and then they're like, well, why don't you just go exercise? And you're like, okay, I'm
Mm,
gonna kill you.
yeah.
And the only thing worse are the freaking doctors.
Mhm.
If a doctor can't treat it, it doesn't exist.
Yeah.
And the horror stories of just doctors, and the dumber they are, the more adamant they're right, and the
Mhm.
meaner they are.
Yeah.
It makes me sick.
I agree. I had my share of those before I finally figured out what was going on. But thankfully, I found some really amazing doctors in
Yeah.
practice as well that has helped me come leaps
Oh, thank
and
you.
bounds in my own healing. So thank you for being one of the good guys out there.
We're trying.
Amazing. Dr. Holtorf, if people want to find you and get more information on you and the peptides, how can they find you?
Yeah, so we're at Holtorf Medical Group. We're in El Segundo. We do telemedicine, and that's holtorfmed.com. The peptides at integrativepeptides.com. And I'm excited. They're long overdue, but we'll have a lot more products out. We have for thyroid patients. Thyroid was my original passion before peptides. I still love it because that's one of the things that really turned me around was high dose T3, even though my levels were normal.
Mhm.
And so it's a National Academy of Hypothyroidism and Integrative Sciences at nahypothyroidism.org. So if your doctor tells you your thyroid is normal and you're fatigued and cold and depressed, that go look at there's review articles with 500 references, 1,000 references, showing that the way we diagnose and treat thyroid in this country is wrong. And all these people are going untreated that could really benefit. And so that was the goal of that. And we're going to do all our training through the nonprofit. And let me tell you, we started a veterans program.
Oh, cool.
And the first veteran that came through, he terrible PTSD, traumatic brain injury. Then they found him face down, essentially pulseless, liver failure, kidney failure, and they said he's going to die. They put him in an induced coma and said very unlikely he's going to make it.
Wow.
And he also had allodynia, where you couldn't even touch his skin. It just so much pain, but just miserable. He couldn't read. And so he's in this induced coma, and of course, parents are freaking out. But he makes it. He's tough. He's special forces, right? And he makes it out. But he goes to all these neurologists, and he has also like scarring on the hippocampus, and he's just like like he couldn't function. And he made it to us through like a friend of a friend in Hawaii or something. And on the first visit, we got rid of his allodynia. We just did this super like immune modulatory treatment on the second visit, and he's dramatically better.
Oh.
And by the fourth visit, he could read a book. He could
Amazing.
sleep. He went camping. When he goes camping, they go with no sleeping bag. They're special forces. They just and just total turnaround.
Wow.
And that was even before we got to the it was just kind of okay. Let's put you in immune modulation. We don't know exactly what's causing all this, but it's very interesting. And all these vets that we've treated, every single one of them is positive for Lyme, and most of them for multiple co-infections, massive amounts of toxins, and of course leaky gut and terrible guts, and antibodies to their brain.
Wow.
And so basically it's that you'll see, especially for instance, like a lot of the people will go over to Africa and do a nice thing, and or India, we're going to help the underprivileged, and they come back, they're never the same. And they got some gut infection, and then it causes autoimmunity.
Yep.
And so it's a big problem. And so they all have what's called PANS, and no wonder they don't get better with antidepressants, and they have antibodies to their dopamine receptors, serotonin receptors. And so again, well, how do you treat these patients? Immune modulation, lower those antibodies. And it's kind of the same thing with Hashimoto's, that all Hashimoto's patients need to be treated with thyroid, especially T3. And they'll feel better. But they actually feel even much better if you modulate the immune system and lower the antibodies.
Yep.
And because it also will lower the mitochondrial antibodies and the pituitary antibodies. So it's really a take-home message, I think, is look at that immune system
Mhm.
and then the other peptides. The nice thing with the peptides is you can't go wrong. I mean, you can't, you know, there's you
Doesn't sound like they'll do anything wrong if you take them and you just
oh,
don't
you
eat
can take
them,
a whole
right?
bottle. I mean, they can't find a
Yeah.
toxic dose, you know.
Yeah, that's great. It
Yeah.
means that they're super safe for most people to pretty much everyone to take and
Yeah.
see if it can
And we'll be
support
coming out with peptides soon.
for pets.
Yeah.
I'm ready for those. My dog is gonna need
No,
those.
we give them to pets all the time and they're limping like our dog. We have Ivan the Terrible. He's a terrier. Oh my God, he's terrible. But like he'll limp and then we'll give him BPC and then, we'll kind of forget and he'll come back after 3, 4 months and
Uh-huh.
so it just keeps them,
Yeah.
yeah, and it works on their gut, so it improves their microbiome
Uh-huh.
and gut function, lowers inflammation. Yeah.
That's amazing. Awesome. Well, thank you so, so much for sharing all this amazing information. I really hope people take a deep dive into peptides and see if it can help them on their healing journey. So
Well,
thank you
great.
for
Thank
this.
you so much and keep up the great work. And I appreciate the invite.
Yeah, thank you so much.